So today I am going to talk about the Guillain Barre Syndrome, which is also represented by GBS. And GBS, it is also termed as acute inflammatory demyelinating polyneuropathy. It is also called as acute inflammatory demyelinating polyneuropathy. Acute means the disease has a sudden onset, inflammatory means it is inflammatory disease, while demyelinating means that in this disease there is segmental demyelination occur. We will be discussing it later. And there is polyneuropathy. It means there is simultaneous malformation of many peripheral nerves throughout the body. So it is also termed as polyradiculoneuritis. Polyradiculoneuritis. Actually, in GBS, it predominantly affects the motor system. So GBS, it predominantly affect the motor system, while sensory system may or may not be involved. While sensory system may or may not be involved. Now GBS, it is associated with the important triad, and that triad is, for that we have a mnemonic that is was, where W stands for the weakness of the body, it termed as weakness. A stands for areflexia, while S stands for the sensations, and sensations are intact. So the important triad is weakness of the body and areflexia. There is no deep tendon reflexes, and the sensations are intact. We will be discussing later it in a detail. Now let's discuss the neuronal structure. Now, as you are familiar about the nerve structure, now let's suppose we have a nerve, and these are the dendrite of the nerve, these are axons, and the terminal portion is termed as terminal axon. So these are dendrite, these are cell bodies, these are axons, and these are axon terminals. Now the axon, it is covered by a fatty layer. The axon is covered by a fatty layer, and there is a sheath present, and this is called as myelin sheath. This is called as myelin sheath, and actually it insulates the axons, meaning it increases the saltatory conduction of the nerve. Saltatory conduction means that the impulse is transmitted from one node of Ranvier to the another node of Ranvier. So actually the myelin sheath, it increases the saltatory conduction of the nerve. Now this is important, that inside of the myelin sheath there are specialized sort of cells are present. Inside of myelin sheath there are specialized sort of cells are present, and that is called as Schwann cells. That is called as Schwann cells. And one of the most important functions of the Schwann cell is to myelinate the axons of peripheral nervous system. So the most important function, one of the most important of the function of the Schwann cell is to myelinate the axons of peripheral nervous system. Now the GBS, actually it is a disorder of peripheral nervous system. So it means that the cranial and spinal nerves are equally affected. So actually it is a disorder of peripheral nervous system, and where cranial and spinal nerves are equally affected. Also, and actually in GBS, the body immune system is hyperactivated. Here the body immune system is hyperactivated, which lead to the Schwann cells destruction. which lead to demyelination of nerves that often lead to nerve conduction blockage. Now, actually, the body is hyperactivated in a disease of GBS where it leads to the Schwann cell destruction. Now, the major function of the Schwann cell is to myelination. Here, if the Schwann cell is destructed, so it leads to the segmental demyelination. Here, it leads to segmental demyelination of nerves, and as a result of that, the nerve conduction is hampered. Now, let's discuss the causes of the GBS. So there are a lot of causes of GBS, but we will be discussing the major causes of GBS. So one of the most common cause of GBS, that is Compylobacter jejani. That is Compylobacter jejani. And this Compylobacter jejani, it usually causes the gastroenteritis. It causes the gastroenteritis. Now, how the Compylobacter jejani causes the GBS? Actually, Compylobacter jejani, it enters into blood, and after 1 to 4 weeks, the antibodies are produced against it. Antibodies produced against the Compylobacter jejani and blood. Now, that antibodies crosses the blood-brain barrier and attracted into the gangliosides and Schwann cells, which lead to the Schwann cell destruction. So there will be no myelination. It means there will be demyelination of nerves occur, which lead to nerve conduction blockage. Now, how the Compylobacter jejani causes a disease? Actually, it enters into blood, and after 1 to 4 weeks, antibodies are directed against the Compylobacter jejani and the blood. After that, the antibodies, actually it crosses the blood-brain barrier and attracted into the gangliosides and the Schwann cells, which lead to Schwann cell destruction. Ultimately, there will be no myelination and there will be nerve conduction blockage. Now, the point is, actually, there is a question how the antibodies and why the antibodies are attracted into the gangliosides and the Schwann cells. So the answer is that the lipopolysaccharides of Compylobacter jejani has a molecular mimicry with that of gangliosides. So that's the reason that the antibodies are directed and it is attracted into the gangliosides. So it is the most common cause of the GBS. While the second most common cause of GBS, that is autoimmunity. So the second cause is autoimmunity, where antibodies are directed against the Schwann cells, which lead to demyelination. Now, although there are another causes there are respiratory tract infections or gastro and GI infections can lead to the GBS. Whenever if a patient has a respiratory tract infection or GI infection, so after 1 to 4 weeks of that infection, there is a chance of GBS. So now let's discuss the causes of the clinical features of GBS, that how the patient will be presented to you if one is suffering from the GBS. Now, as I told you earlier, the GBS, it is associated with important triad, and that is, for that we have a mnemonic, that is WAS, where W stands for the weakness of the body. Weakness of body. Now, actually, the most diagnostic feature and the most defining sign of the GBS, that there is ascending symmetrical paralysis occur. So there is ascending symmetrical paralysis occur. So what does it mean? It means that the paralysis initially it started from the lower extremities and then it shift toward the upper extremities. And always please keep in mind that the paralysis that started from the lower extremities, it is always symmetrical, meaning the paralysis is not started from the one side of limb or another side of limb. It is always started from the both of the limbs. So there is initially the paralysis started from the both side of lower extremities and then it shift to the upper extremities. And if it shift to the upper extremities, so it can affect the diaphragm as well. So when the disease is ascending upward, so it may affect the diaphragm. And as you know that diaphragm, it is the active muscle of the inspiration. So if diaphragm is affected, so it may lead to the respiratory failure. So patient may lead to the respiratory failure, and it is considered as a most dangerous complication in the GBS. So respiratory failure in case of GBS, it is the most dangerous complication. It is the most dangerous complication. So when diaphragm is affected, so the patient may go in a state of respiratory failure, and it is the most dangerous complication, the GBS. Although if the disease is transmitted to the or it is ascending upward, so it may affect the face as well. So there could be a feature of facial weakness in a patient, or there may be facial paralysis occur, and it is being reported that in 40 to 50% cases the patient usually presented with the facial weakness in case of GBS. So it is in 40 to 50% cases the patient may manifested with a facial weakness. So these are important. Also there is A stands for the areflexia. So there is no reflexes, no deep tendon reflexes will be there in case of GBS. Although there is S. So S stands for the sensations. So sensations are usually intact, but if sensory component involved, so there may be distal paresthesia or numbness. So if sensory component involved, so there may be distal paresthesia or there may be numbness. So I repeat, what are the most important features? That is weakness, and actually there is mainly ascending symmetrical paralysis occur. It means paralysis starts from the lower extremities, then it shifts toward the upper extremities. While if you talk about in poliomyelitis and polio, actually there is descending asymmetrical paralysis. But in case of GBS, there is ascending symmetrical paralysis. Also, if it involves the diaphragm, then it may lead to respiratory failure. If the facial muscles is involved, so there may be facial weakness. Also, there is no deep tendon reflexes are there. The sensations are usually intact, but if the sensory component involved, so there might be a distal paresthesia or numbness. Now, there is most important variant of GBS, and that is termed as Miller-Fisher syndrome. That is called as Miller-Fisher syndrome. So Miller-Fisher syndrome, it is actually the most important variant of GBS, and usually there is ophthalmoplegia here. There is ophthalmoplegia, means there is pain in eye. There is ataxia and areflexia. So this is the most important triad of Miller-Fisher syndrome, where there is ophthalmoplegia, there is areflexia, and there is ataxia. So now let's talk about how you will able to diagnose a disease of GBS. Now let's discuss the diagnostic evaluation. Now, what is the most important and what is the best initial test in case of GBS. So the best initial test is lumbar puncture. So let's discuss the diagnostic evaluation. The best initial test is lumbar puncture. It is considered as best initial test, and actually lumbar puncture, it actually show the albuminocytological dissociation. It shows the albuminocytological dissociation. It means increase CSF proteins in absence of elevated cell count. Now, actually, in case of GBS, the proteins are increased. Protein is more than 55 mg%, while cell count it is less than 50 per ml. So usually here the protein is more than 55 mg%, while the cell count it is less than 50 per ml. And usually the LP it is done after 48 hours, and mainly it is the limitation of this test. It is done after 48 hours, and that's why it's the limitation of the test. So what is the most are the best confirmation test in case of GBS? So the best confirmation test of GBS, that is electromyography. And electromyography, there is decreased nerve conduction velocity. So in case of GBS, there will be decreased nerve conduction velocity. What does it mean? It means, let's suppose we have a nerve. Let's suppose this is a nerve. Yes. Now let's suppose this is a nerve, and this is the A point, and this is a B point. Now if I put the needle at A point, similarly if I put the needle at B point, now if I stimulate the A point and if I record the timing of impulse from A to B, so if it takes more time, if impulse takes more time to reach from point A to point B, it means that the nerve conduction is low. It means there is nerve conduction is blockage, or if there is nerve conduction slowing, so it indicates that the nerve conduction velocity decreases. So similarly, in case of GBS, in electromyography, which is the confirmation test in case of GBS, it will show us the decreased nerve conduction velocity. Now, also we can do the spinal MRI. The spinal MRI, it is done in less than 3 years of child to rule out the compression lesion of spinal cord. Also, we can go for the anti-ganglioside antibody. Anti-ganglioside antibody. So, what are the investigations options? There is, the first is, that is LP, which is the best initial test. It will show the albuminocytological dissociation, meaning there will be increased CSF protein and despite of elevated cell count, and the protein will be more than 55 mg it is more than 55 mg percentage, and it is most important to remember that the protein will be more than 55 mg%, while the cell count is less than 50 per ml. So it is very important, and please keep this in your mind. Secondly, there is electromyography, which is considered as the best confirmation test. Here there is decreased nerve conduction velocity. Also there is spinal MRI, and there is anti-ganglioside antibody. Now let's talk about the management or treatment of GBS. So as the disease is diagnosed, so we should treat the patient as soon as possible. The reason is that there might be a chance of respiratory failure. That patient may go in a state of respiratory failure. So it is very important that we should treat the patient as soon as possible. Now, the first is we can do the physiotherapy. So first option is physiotherapy. Is in case of GBS, there is flaccid paralysis occur. So the physiotherapy is important. Secondly, we can give the intravenous immunoglobulins for 2 to 4 days, and also we can give the plasmapharesis for 4 to 5 days. Actually, in plasmapharesis, we remove the patient plasma along with the anti-myelin antibodies. So there is 3 options: physiotherapy, intravenous immunoglobulins, and plasmapharesis. So these are the most definitive treatment option. Now, what is the prevention of the disease? Now, it is being reported that in 60% cases, usually the patient recovered fully. So 60% cases patient recovered fully, while 10 to 15% cases the patient recovered partially, while 5% cases there is a chance of motility. So I repeat, what is the prevention? That is 60% cases the patient recovered fully, while 10 to 15% usually the patient has a partial recovery rate, while in 5% cases there is motility chance, and that motility is usually because of the most dangerous complication of GBS, that is respiratory failure. So the motility is because of respiratory failure in case of GBS. So students, that's all about the GBS. So thank you so much.